The day after tomorrow, the first baby boomers will celebrate the big 6-5. And they're not just getting older, they're getting more costly. Boomers are the 77 million Americans born from 1946 through 64. Beginning January 1st, 10,000 a day will turn 65. That will continue for the next 19 years.
The retirement of the baby boom generation will bring a tsunami of spending that will cause a severe problem for the federal government's budget over time.
Take Medicare, health care for the elderly and disabled. The number of people eligible will nearly double from 46 million to 80 million by the time all the boomers reach 65. It's estimated the cost will grow from $500 billion a year today to $929 billion by 2020.
Ultimately, we're going to have to make tough choices about how much health care can we afford and sustain, and how are we going to change our payment systems to make sure that it doesn't bankrupt the country. Because if there's one thing that could bankrupt the United States, it's out-of-control health care cost.
Medicare is already underfunded by at least $23 trillion. That's the difference between the benefits promised and the taxes actually being paid into Medicare. It could go bankrupt as early as 2017. Yet Americans still apparently want it all. According to a new poll, they don't want to raise the age for Medicare, and a majority of both Democrats and Republicans, young and old, would rather raise taxes than cut benefits.
What are you talking about?
The healthcare town hall meetings gave a glimpse into how Americans react when they think their benefits might be cut.
This is anarchy! It's anarchy! Dare take it away from me!
To save the system, fiscal watchdogs insist Americans will ultimately have to work longer and get used to less government help. The question is not if changes will have to be made, but when politicians will choose to make them. Harry?
Sharyl Attkisson in Washington tonight. Thank you.